Welcome to English News Today, where we bring you the most important updates from around the globe. In today's report, we are diving into a critical and alarming development in global health, the ongoing Mpox outbreak in Africa, which has now been declared a global health emergency by the World Health Organization. The World Health Organization on Wednesday announced that the Mpox outbreak in Africa has escalated into a public health emergency of international concern. This decision comes after the emergence of a deadlier strain of the virus, known as clade IB, which has now spread to 4 previously unaffected countries in Africa. The outbreak, which began in the Democratic Republic of Congo, has rapidly crossed borders, raising concerns about further spread both within Africa and beyond. In an emergency committee meeting, independent experts advised Director General Tedros Adhanom Ghebreyesus on the severity of the outbreak. Following their consultation, the decision was made to declare the situation a public health emergency of international concern, or PHEIC, the highest level of alarm under international health law. This outbreak is not just a local concern, it is a global issue. Over 17,000 cases and more than 500 deaths have been reported in 13 countries across Africa since the beginning of the year. The Democratic Republic of Congo alone accounts for more than 14,000 cases, making it the epicenter of this crisis. Mpox, formerly known as monkeypox, is a viral disease that spreads easily through close contact, including touching, kissing, or even through contaminated materials. Symptoms include fever, painful rash, headaches, and muscle pain. One of the major concerns is that we are not dealing with just one outbreak of a single clade. We are facing multiple outbreaks of different clades, each with varying modes of transmission and risk levels. To combat this, WHO is calling for a coordinated international response. This includes increased surveillance, diagnostics, and research to understand and contain the spread of this virus. WHO has also signed off on the emergency use listing from Mpox vaccines and developed a regional response plan requiring $15 million. The United States Centers for Disease Control and Prevention (CDC) is closely monitoring the situation and has recommended vaccination for those at high risk of exposure. The global community must come together to support efforts in Africa and prevent this outbreak from spiraling out of control. WHO officials are confident that, with the right measures, this outbreak can be contained. But time is of the essence. We must act now to stop the spread and save lives. As the world continues to battle this new threat, it is clear that global cooperation and swift action are essential. Stay informed, stay safe, and let's work together to overcome this health crisis. Thank you for watching English News Today. Don't forget to subscribe and hit the notification bell to stay updated on this and other important news stories.